Palliative care, to me, I always thought was more end of life. Then they explained it to me, it's about the quality of his life and to help make him feel better and take some of the pain away. To see your son in pain and you can't do anything about that. And, you know, Dr. Freebert and her team stepped in and they just, you know, figured out what was wrong with Chris.
It's a great place. They help you in any way they can.
They're like another family. They really are.
How you doing?
That's sleepy, but I'm good.
Are we talking about you? Before the cardiac arrest, Emmanuel was basically typical. He just had the colostomy bag. Emmanuel was looking around, making noises on his belly. He was on track. It's when he went to cardiac arrest and had the brain damage. That's what caused him to be in the current condition he's in now. And because of what he's went through, it allowed us to meet palliative care. We called them our extended family.
Yeah.
They were really like an extended family
yeah,
to us.
They really are.
And they had hope. And I think that's what also helped is you could see that they had hope about this situation.
I've come to see that healing is far more than curing. We call our program a palette of care. A palette describes all of the services working together in a way that we feel really brings the essence of what it is that we do for families. A palette, if you're an artist, a palette is a container for lots of different colors that you use to create an artistic impression. And so what we've done is to try to create a palette that has multiple different team members on it, or specialties, or disciplines, so that a family can have all of these options in front of them, can select what works for them, and can paint a picture of quality of life for their family.
Our unit of care is really the family, not just the patient. What I try to help families understand is that to palliate means to ease the burden of. If your child is profoundly ill, it's a blessing to have somebody make a phone call for you or ask you, how are your other kids? Or do you need gas to get here to the hospital? And I think that that just eases the stress of a situation that can be awful for a family.
They take a personal interest in like what's going on, what he's thinking, how he's feeling emotionally as well as physically. Palliative care. They've told him they don't care if it's 3 o'clock in the morning. You pick up the phone, you call us. If you need someone to talk to, every one of us is here for you. And you know, you don't find that many places.
For a large number of families, we're on board for a long time. We frequently tell families, once you sign on with palliative care, you always have us. And we mean that. We tell families we're going to walk on this journey with them, and we're committed to doing that. Many families are facing some devastating diagnoses for their children. We can't take it all away, but we can make it better. Help them navigate different systems, insurance, Medicaid, waivers, all the things that they may have to have in place at their home, medical equipment, supplies, intermittent skilled nursing visits, as well as private duty nursing. We try to think of everything.
The palliative care program has very rapidly gained the attention of providers and organizations in our region, in the state, and really truly around the country. We are being looked to by many other programs around the country to help them develop something similar to this.
The greatest challenge that we have is financial. The type of care that we provide is mostly not reimbursed because of the structure of our current healthcare system. Our healthcare system rewards procedure-driven, very intense, aggressive medical care in our payment structure. And the kind of care that I've been describing is provided by people who primarily spend time with families, listen to families, help them make good decisions about the care of their child. It's what families are demanding, what they're asking for, what they need to survive. And it's not something that we get reimbursed for on anywhere near the scale that it takes to be able to provide this kind of care.
Pediatric palliative care goes beyond treatment within the walls of the hospital. Many of the patients are cared for in their homes. This requires people to go to the homes and offer emotional support and offer spiritual support.
There's a quote that's often used when you're dealing with children, and that is, 100 years from now, it will not matter what car I drove, what job I had, or how much money was in my bank account, but that I made the difference in the life of a child. And with Akron Children's Hospital Palliative Care Center here, that difference may be just enough social work to help them through a tough time, but may also mean dealing with someone who's not going to make it. And we wanted to make sure that our difference was being made in the lives of these children, that we could help others who are making those differences. And that's why we support the hospital. And that's why we support Dr. Sarah Freebird and the Haslinger Center.
With the complications of his conditions, it was just a lot of stuff that was just up in the air, a lot of things we didn't understand, and they were just there.
You want to protect your children no matter what, and I couldn't do that.
It's okay.
They care greatly for everyone, and I just, the quality of life they've given Chris is so much more than what he had from the beginning. And honestly, he wouldn't be where he's at today if it wasn't for them. And I will be eternally grateful for everything they've done.